Hello, greetings. So let's talk about antipsychotic drugs. So antipsychotic drugs, these are nothing but drugs that are used in the treatment of psychosis. These drugs are classified in two. We have first generation antipsychotics and we also have second generation antipsychotics. Let us start with the first generation antipsychotics. So the first generation antipsychotics, they are sometimes referred to as typical antipsychotics or simply traditional antipsychotics. How do these drugs work? What is the mechanism of action? What is the mode of action? Okay, so these drugs, they basically work by blocking dopamine receptors. So once dopamine receptors have been blocked, that basically means that the neurotransmitter dopamine will fail to stimulate the postsynaptic neurons, hence leading to relief of hallucinations, delusions, and also illusions that are predominantly associated with psychosis. Yes. Example of drugs that falls under this class, we have haloperidol and also chlorpromazine. Yes. So these drugs, they have massive side effects, which we call extrapyramidal side effects, such as tardive dyskinesia, akathisia, torticollis, even opisthotonus. So to prevent these side effects, we administer these drugs with an antiparkinsonian drug. Example of that is what? Aten. Yes. The second class is the second generation antipsychotics. So the second generation antipsychotics, they are sometimes referred to as what? Atypical antipsychotics. Yes. So second generation antipsychotics, they basically have similar mechanism of action as what? The first generation antipsychotics. The only difference is that the second generation antipsychotics, they have weaker effect on dopamine receptors, but they have a potent effect on serotonin receptors. Example of such drugs, we have olanzapine and also risperidone. Yes.